So within Southwestern Public Health, we now have, since January 1st, 2025, 35 confirmed cases in our region. There is also concern regarding ongoing healthcare exposures that have been reported to us. I do want to mention and talk about risks. So we do post and do public notifications of measles exposures. These notifications are when we are not confident we are able to reach everyone who has been exposed at a particular setting. So we shouldn't rely purely on these notification exposures and the online assessments. Measles is in our community. So if you are not fully up to date on your vaccinations against measles, you are at risk. So for those who think they may have measles, then it is a requirement or a necessity to stay at home unless you absolutely require medical attention. You certainly shouldn't be, you should be avoiding those who are particularly vulnerable and at risk for serious complications. That may include those who are immunocompromised, pregnant, or very young infants. And if you are in that category yourselves in terms of being immunocompromised, pregnant, or with very young infants, you should avoid those who have or might have measles. Now I want to talk briefly about vaccines. Just a reminder that measles is not a new or novel illness. It's been around for decades, and for a period of time, we thought in Canada we had predominantly eliminated measles. It certainly resurfaced within our region, but there are things that we can do in terms of vaccinations. There are a variety of different reasons why people might not be vaccinated, and it is, we work towards addressing any disinformation or misinformation about the vaccines, but there are other reasons, whether it's medical exempt reasons or due to age of individual or lack of healthcare access, people are not up to date. So it is still important and crucial to be up to date on your vaccines. And as we're seeing, any small decline in vaccine coverage can lead to significant amount of measles circulation. I want to hand back the control to our moderator, Sean.
Thank you, Dr. Tran. Now over to you, Dr. Locke, with an update from Grand Erie Public Health.
Thank you, Sean. Good morning, everyone, and thank you for taking the time to join us today. My name is Malcolm Locke. I'm the Acting Medical Officer of Health at Grand Erie Public Health. On the Grand Erie Health side of things, we're continuing to monitor and manage the outbreak of measles in our region. As of now, we currently have 57 lab-confirmed cases of measles within the Grand Erie region. Of the total cases, 9 are adults and 48 children. And the majority continue to be in the Holdham and Norfolk areas of our region. As we continue to manage and monitor the measles situation in our area, we do have a list of exposure locations which is updated regularly on our website. So we would encourage the public to have a look. www.bchu.org/measles or www.hnhu.org/measles. While the list of exposure locations is critical in managing the exposure, we want to continue to remind the community members that their first line of defense against measles, as Dr. Tran has already mentioned, is to make sure that your loved ones and your family are up to date with their immunizations. Generally, adults born before 1970 are considered protected against measles from natural immunity, and no booster doses are needed. For those born in or after 1970, 2 doses of measles-containing vaccine provide up to about 99% lifelong protection. Typically, children receive a first dose at the age of 1 and a second between 4 and 6 years older. In response to the current community outbreak of measles in our region, however, the Ministry of Health and Public Health Ontario are advising some updates to the publicly funded vaccination schedule for measles to take effect immediately. That includes for those who live, play, travel, or worship otherwise in the Grand Erie Public Health area and Southwestern Public Health regions, expanded eligibility for infants 6 months to 11 months of age, accelerated schedule for second doses in children under 4 years of age, and second dose for adults born in and after 1970. The measles-containing vaccine is available through your primary care provider or through one of the various community clinics Grand Erie Public Health is offering. Earlier this week, we hosted our first community clinic in Burford, which was a great success, and we have another this afternoon, and others over the next few weeks. There are still appointments available. To book an appointment for one of your community clinics and to stay up to date on additional upcoming visits, again, visit the websites www.bchu.org/measles and www.hnhu.org/measles. It is important, as Dr. Tran has also mentioned, to call ahead before visiting a medical clinic or hospital and advise them of an exposure or symptoms to allow them to prevent the spread. Anyone who has been exposed to the virus or is experiencing symptoms should wear a medical grade mask when visiting a healthcare facility. As we continue to respond to the measles outbreak in our regions, I want to stress the importance again of ensuring that you and your family are up to date with your immunizations. And if you're not, please reach out to your primary healthcare provider or visit our website for more information about our community clinics.